3 a.m. Trauma Bay 1. Another code blue? No. This time, it's a 27-year-old on a gurney, completely yellow. Not from liver failure, from pure, crushing dehydration. They're dry as a desert, their blood pressure tanked, and they're vomiting so violently their esophagus is torn. The cause? Not a car wreck, not a heart attack. It was a syringe. The drug? Ozempic. And this patient was a victim of the dangerous celebrity dosing secrets you see all over social media. The ones that promise fast-track weight loss. I'm an ER doctor, and I'm going to share 3 true patient confessions, 3 distinct ways people are overdosing on semaglutide, and the exact protocol you must follow to avoid becoming my next patient. Let's be crystal clear. When I say overdose, I don't mean a fentanyl-level event. I mean a dose so far outside the clinical range that it precipitates a medical crisis requiring hospitalization. It's a crisis of the gut, the kidneys, and the blood sugar, and it's driven by vanity, impatience, and the lie that faster is better. The first case is the most common and the most reckless. We call it the turbo dose. This patient came in after self-injecting a full 2.0 milligram dose, the maximum therapeutic dose, on their very first day. The lie they heard on some influencer's feed was, why waste time on the starting dose? Just go for the max and get results now. This isn't an accelerator, it's a hand grenade for your GI tract. Ozempic works by slowing down your stomach emptying, a process called gastric motility. This is why you feel full. But your body needs time, usually a full month, to adapt to even the starting dose of 0.25 milligrams. When you skip the 4 weeks of titration, the stomach paralyzes. You get intractable, severe nausea and vomiting. We're talking 3 or 4 straight days of severe vomiting that causes profound dehydration, which is how people end up with acute kidney injury requiring IV fluids in the ER. Confession number 2 is a subtle, insidious secret circulating in Hollywood circles. The stacker, or the extra click. This is pure dose manipulation. Semaglutide is a once-weekly medication, but the myth suggests that since a small dose is good, a second shot 3 days later is better. Or even more dangerous, that the pen's dial can be overclicked for a slightly higher dose. These patients arrive with a different problem, profound refractory hypoglycemia. They're dizzy, sweaty, shaking, and their blood sugar is dangerously low. Think of the medication's half-life. It stays in your system for about a full week. Taking an extra dose, or stacking it, doesn't speed up the effect. It just doubles the active concentration in your blood. This drives your blood sugar down into dangerous territory, a problem that can land you in a coma if you're not rushed to the hospital for IV dextrose. The final confession is the crash cocktail. This is when patients try to pair the medication with extreme crash dieting, or worse, other stimulant-based weight loss pills. The secret is to use the appetite suppression of the GLP-1 drug to fast or restrict calories down to 800 or 900 a day. The problem here is a lethal combination, starvation-induced side effects. Your body is already under stress from the drug, which causes a mild, controlled slowdown of the digestive system. When you then strip away all fuel, all electrolytes, and severely restrict water, you set yourself up for a catastrophic collapse. The resulting vomiting and diarrhea are magnified tenfold. I've seen patients in the ER with electrolyte levels so depleted, especially potassium, that they were at imminent risk of a cardiac arrhythmia. The drug itself is not the overdose. The combination of the drug with an irresponsible, starvation-level diet is. Forget the whispers from Hollywood trainers. This is the only secret that matters. This is the FDA-approved protocol. If you or someone you know is taking this medication, you need to understand the titration schedule is a safety feature, not a suggestion. Weeks 1 to 4, start at the initial dose of 0.25 milligrams once weekly. This is the crucial adaptation phase. Weeks 5 to 8, increase to 0.5 milligrams once weekly. Weeks 9 to 12, increase to 1.0 milligrams once weekly. The maximum is 2.0 milligrams once weekly, and you only move up if the previous dose is well tolerated. You stay on each dose for 4 full weeks. That is a minimum of 8 weeks to reach the maintenance dose of 1.0 milligrams. If you try to skip that ladder, you end up on my table. The real takeaway: your health is not a Hollywood fast track. The only safe and sustainable way to use these powerful medications is under the strict guidance of a physician, following the approved titration schedule. If you are experiencing severe vomiting, unrelenting diarrhea, or signs of low blood sugar, do not wait. Go to the nearest emergency room. Call to action. If this video saved you from making one of these dangerous mistakes, hit the like button to get this information out of the celebrity gossip channels and into the hands of those who need real medical facts. Subscribe to XORX for more high-value health content straight from the front lines.